Welcome to the Healthy Food, Healthy Farms webinar series. Today's webinar is the Autism Revolution, Thinking About Environment and Food. I'm Kathleen Schuler with the Institute for Agriculture and Trade Policy. The Institute for Agriculture and Trade Policy is a Minneapolis-based nonprofit organization that works locally and globally at the intersection of policy and practice to ensure fair and sustainable food, farm, and trade systems. IATP's work includes Healthy Food Action, a nationwide effort to engage health professionals in food and agriculture policy issues critical to creating a healthier food system, and Healthy Legacy, a statewide campaign to advocate for safer consumer products without the use of toxic chemicals. Today's webinar is co-sponsored by the American Holistic Medical Association, a nonprofit membership association for physicians and other practitioners of holistic medicine. You can read more about its current activities at holisticmedicine.org. So today we are joined by Dr. Martha Herbert, who is a Harvard pediatric neurologist with a brand new book. I'm going to switch to the biography page, called The Autism Revolution, Whole Body Strategies for Making Life All It Can Be. Prior to her medical training, Dr. Herbert obtained a doctoral degree at the University of California, Santa Cruz, studying evolution and development of learning processes in biology and culture, and then did postdoctoral work in the philosophy and history of science. Her background in pediatric neurology, evolutionary biology, and the history of science has oriented her towards systems biology, brain connectivity, and dynamism, and brain-body interrelationships. She received the first Cure Autism Now Innovator Award and is now on the Scientific Advisory Committee of Autism Speaks. Our second speaker today is Renee Dufault, founder and director of the Food Ingredient and Health Research Institute. Prior to her current position, Professor Dufault worked at the U.S. Public Health Service for 20 years, pursuing the environmental state of mercury in the chlor-alkali industry. Her collaborative team worked to determine how this source of mercury exposure might interact with other epigenetic risk factors to affect learning in children. Professor Dufault is recognized as a biomedical expert in the areas of mercury toxicity, epigenetics, fructose, and environmental hazard assessment. So today we will be taking questions from the audience after our two panelists have finished their presentation. You can submit your questions at any time during the webinar by using the question panel on your screen. Just type in your question where it says enter question for staff and hit send. We will review questions as they come in, and the panelists will respond to as many questions as time allows. If you have trouble with your audio, we recommend that you try calling in on the phone line if you haven't already. Call-in information can be found by clicking the plus sign next to the word audio on your webinar panel, and then selecting Use Telephone. The slides from today's webinar will be made available on the Healthy Food Action homepage within 2 or 3 days, so be sure to check back at healthyfoodaction.org. Today, we'll be talking about a very important public health concern, the rising incidence of conditions affecting children's behavior and brain development. The CDC estimates the incidence of autism at an astounding 1 in 88 children. But what is causing the rise in autism and how we can work to prevent it is not clear. Our presenters will shed some light on this important issue as they discuss the ways in which genetics, diet, and environment intersect to affect a child's development and the onset of autism. Now I will hand it over to our first presenter, Dr. Martha Herbert.
Thank you very much. Can people see my slides now? Or do you see where'd my cursor go? I apologize. I just had the slides on view mode. And now, there we go. Oh, okay. There we go. Now can you see my slides? Can someone on staff respond? Yes. So I'm going to talk with you about a model of autism that I have laid out in my new book, The Autism Revolution, Whole Body Strategies for Making Life All It Can Be. It's really a systems biology approach to autism, but it's told through stories of people who got better and how they got better, and the 4 areas that everyone took account of in one way or another, every family in getting their child better or adults who got better, were food, toxins, bugs, and stress. So this is a very different model than what people have been exposed to in autism. And what the standard model of the field was 15, 20 years ago, and still is for many people, is what I call a Lego or modular model, which is that there were specific genes affecting the brain in specific ways, leading to each of the component behaviors of autism: communication, social interaction, and restricted behaviors. And indeed, autism has been defined psychologically. It's been assumed that these genetic defects in the brain have been determined before you're born, and there's nothing that you can do about it. But that model has been coming apart at every level. We're not finding individual high-influence genetic problems. The brain problems are not little modular problems, but network and regional and tissue problems. And people are getting better, so there is something you can do. So looking at this gene-brain behavior model, look how it constrains us. It gives us the option of really waiting for gene therapy for genes, of treating brain problems with drugs, and of treating communication and social interaction and behavior problems with behavior therapy. But is that all to it? So in this model, the whole body model, I'm going to give you a much more nuanced picture, a whole body model of vicious circles in brain and body. So certainly there's genetics, but there's also the psychosocial and the physical environment. Together, these genetic and environment considerations affect core cellular dysfunction, energy, metabolism, cellular signaling, and metabolic processes more broadly. This, of course, affects the brain, and as a consequence of this dysfunction, you get the social interaction, communication, and behavior issues that have been used to define autism. But you also get sensory, sleep, seizure, and also, not on here, speech and language issues related to brain differences in brain function. And you also have body issues. Brain and body are related. Sensory, sleep, seizure, speech, and language are affected by bodily issues, and you also have gastrointestinal, immune, hormonal, and more issues. And the body, the brain, our issues are related, and together you're led to a situation of frustration, of being more easily overwhelmed, of having pain, poor function, and sickness. And the accumulated impact of this is overload and stress, which feeds back and further degrades cellular function. So this whole thing is a vicious circle that drives itself. And in order to improve the well-being of people with autism, we need to intervene at many levels to take the strain out of multiple parts of the system. So that's the model that I present in my book. And autism is complex. There are levels that are all involved at the same time, from genes, chemistry, cells, and organs, to the brain as a wet physical organ with cells and fluids and blood, to the stress system, to brain as a complex and strained information processing system, behavior, learning, social interaction, and creativity. And in my book, I walk you through all these levels and how they interact like in a web. What you get from this is a whole body systems model where the symptoms emerge from problems with underlying functions. And hopefully on the posting of these slides, the links will be live and take you to websites with more information. You see on the top the 1/9 of the iceberg that's sticking up, the visible social and behavioral symptoms, but underneath that are systemic functional disturbances that are changing the way the system works. Whole body involvement suggests environmental influence. The character of multi-system involvement, particularly gastrointestinal, immune, and metabolic, sits at the interface of body and environment. Also notable is that risk for having a child with autism is increased for mothers with metabolic problems like diabetes, obesity, and hypertension. And it's increased for mothers who do not take prenatal vitamins before conception in the first month of pregnancy, particularly those with certain vulnerabilities in their genome. We also know that the numbers of autism, but not of mental retardation, epilepsy, and cerebral palsy have gone up greatly, as you can see in this slide from the state of California in the last 20 years. And the conclusion of the largest autism twin study to date is that susceptibility to autism has moderate genetic heritability, but a substantial shared twin environmental component. It's not a question of whether autism is all environmental or all genetic. It's something that you can parse out according to different factors that are listed in this pie chart here. There are a growing body of associations of environmental exposure with autism risk and prevalence, which Renee will talk about after me. And remember that genetic influence doesn't exclude environment. And I'm not going to dwell on this slide, but there's you can have a lot of gene and a lot of environment influence together because genetic and environment don't have to add up to 100%. I summarized a lot of this in my article in Current Opinion in Neurology a couple of years ago, Contributions of the Environment and Environmentally Vulnerable Physiology to Autism Spectrum Disorders, which you can find at the link at the bottom of the page and on my website. One very important thing that you need to be aware of that's very much pertinent to the environment is the identification of inflammation and oxidative stress in autism, particularly in the brain, where glial activation has now been identified in much more than one study. And these changes were similar in intensity in brains aged 5 to 44 years, but more intense in a single brain in a 3-year-old, but that is not enough to make conclusions. I want to point out, though this is not food-related, air pollution is associated with this kind of brain inflammation, and air pollution is a cesspool of many different kinds of environmental toxicants depending on where you live. Air pollution has also been linked to autism in a variety of studies. Brain cells and inflammation, what happens to the brain when you're walking around with this kind of chronic inflammation? You see a blood vessel in this picture. The blood-brain barrier is breached and the microglial cell, the blue thing, is getting activated and puffy. It's making excitatory chemicals. Here, tryptophan goes to quinolinate. The puffed up activated astrocyte is creating pro-inflammatory cytokines, and the astrocyte is failing to mop up the glutamate in the synapse. So the overall impact is excitotoxicity, which is very irritating to the nervous system. This kind of model was anticipated without the emphasis on inflammation in the early part of the last decade, with the idea that if the brain has too much excitation or not enough inhibition, you get more irritability, hypersensitivity, and overload, which reduces informational complexity and organization, reduces the amount of signal and increases the noise in the brain, and increases chaos and confusion. And this increased excitation to inhibition ratio can occur from inflammation, oxidative stress, and toxicants, as well as genetic dysfunction, and has whole body system consequences in terms of degrading function. One more thing I want to tell you about is that it's not all a negative direction. There have been a number of very impressive molecular biology studies reversing symptoms in mouse models with syndromes, with genetic syndromes associated with autism. I'm just going to breeze over the 3 of them on this page related to Fragile X, Rett, and tuberous sclerosis, and get to another one in a minute. But I want to mention that even though some of the problems with brain function in autism, such as connectivity and coordination, have been treated as lifelong genetic problems, in a very provocative experiment, David Beversdorf and his colleagues show that you could improve connectivity shortly after, within minutes to less than an hour of giving the drug propranolol, which improves, again, the signal-to-noise ratio by lowering stress and letting the brain access its remote network. Here, I just want to tell you also about a recent, very important paper where another mouse model of Rett syndrome was arrested by a bone marrow transplant of wild-type microglia. Now, Rett syndrome has been attributed to problems with neurons. Then, astroglial cells have become known to contribute. But now, microglia cells are known to contribute as well. When these wild-type microglia enter the system, not hampered by the genetic mutation of Rett, lifespan increased, breathing normalized, apnea is reduced, body weight increased, and locomotor activity improved. And these microglia were doing something that the impaired microglia were not. They were taking out the garbage. When that phagocytic take out the garbage function was inhibited, the improvements were lost. I recently wrote a blog about this, which is the link to which is listed on this slide. So overall, I'm giving you a different model of autism as an emergent property of a system with altered parameters. Oh dear, I'm sorry. Autism could be a dynamic, active consequence of challenges to cellular function throughout the body, including the brain. These cellular changes may be related to environmental insults. Altered cellular response could be at the root of brain and body problems, and this could explain the dynamic features. And many cellular problems can be treated. So you have a recipe for improvement, which begins to segue into the food talk. When someone has 2 bars on their phone, they have poor bandwidth. In autism, poor food with few nutrients, many allergens, with lots of toxins and infectious issues, and with lots of stress and pressure too much too fast, leads to poor bandwidth. But good bandwidth and rich organization are facilitated by excellent food, high nutrient density, minimal allergens, minimal toxic and infectious burden, and love, learning, respect, sensory input, and savoring of each moment, which is a whole body strategy for making life all it can be. I just want to mention that a lot of the more intellectual issues that I've touched on are reviewed in this website, which is in development, but which I have released, Autism, Why, and How, and some of the links here are supposed to link to that. And I want to thank you for your attention. I really do believe we all need an autism revolution, and because the issues that are facing people with autism are quite universal. Thank you. I think we can switch now to Renee.
Thank you, Martha. Our next speaker is Renee Dufault, so we'll turn it over to Renee now.
Okay, can everyone see my screen here? Okay, I'm going to go ahead and go, assuming people can see my slide. Today we're going to talk about how toxic food and environment work as macro epigenetic factors in the development of autism in the U.S. Is there really an autism epidemic in the U.S.? Some people do not think so. They believe the increase in prevalence is due to better diagnoses, meaning fewer children with autism are being misdiagnosed as emotionally disturbed ED or as speech-language impaired. While children with the more severe cases of autism never enter the public schools, we can get an idea of the increase in autism prevalence by looking at the U.S. Department of Education data for the number of children provided special education services. Children receive special education services under 12 or 13 different disability categories. On this slide, we see 5 of them: autism, other health impaired, which often includes ADHD, ED or emotionally disturbed, speech and language impaired, and developmental delay. There are other categories, such as hearing impairment, deaf and blind, and so on, But these categories on this slide are the ones in which children with autism are often provided special education services. The last column provides the total number of all disabled children in the U.S. provided special education services. Here we see that while there has been a 5% decline in the overall number of children receiving special education services from 2005 to 2010, the number of children diagnosed with autism has increased 91% during the same time frame. The number of children with pervasive developmental delay has increased 38%. It is true there is better diagnosis of children with autism, as can be seen by the decrease in the number of children receiving special education services under the ED and speech and language category. But the numbers of children with autism and ADHD are rising over time, even while the number of children receiving special education services is declining. Any public school teacher will attest to this fact. There are many factors associated with the development of autism: mercury, lead, pesticides, to name a few. There are also gene variations among different populations associated with the development of autism. For example, PON1 gene variants are associated with autism in subgroups of the U.S., but not in Italy. Autism prevalence in the U.S. is 10 times higher than in Italy. To try to explain the PON1 gene variation, we compared the diets of these two populations. We also looked at their mercury exposures. So before we go on, what does the PON1 gene do? When the PON1 gene turns on, it produces an enzyme called paraoxenase. This enzyme is required by the body to metabolize and excrete organophosphate pesticides. Any disruption in the function of the PON1 gene paves the way for increased sensitivity to organophosphate pesticide residues commonly found in grains. Children with autism often have low paraoxenase levels. This means they have difficulty metabolizing OP pesticides, which are commonly found in wheat and corn grains. What can modulate or suppress the PON1 gene in the U.S. to create more autism? Exposure to heavy metals such as mercury, copper, cadmium, exposure to statin pharmaceutical drugs, smoking, excessive alcohol, and diet, high fructose corn syrup in particular, and age. Let's look at the American diet. What do we eat? In 2008, each American on average ate 49.3 pounds per year of corn sweetener, including high fructose corn syrup, which may or may not have contained mercury. In a previous publication, we reported our finding of mercury residue in high fructose corn syrup samples collected by an FDA field investigator. Each American also eats a great deal of wheat, which often contains organophosphate pesticide residue, which we reported in our most recent publication. So while we are eating all of this fructose with or without mercury, we are impacting our PON1 gene activity, which can impair our body's ability to metabolize and excrete organophosphate pesticides. The problem with being unable to metabolize and excrete OP is that OP is very toxic to brain development. From this chart, it is clear that wheat may be a significant source of exposure compared to peaches, which sometimes also contain OP residue. OP residue does end up in bread and other wheat and grain end products at low levels. If a child's PON1 gene is not working properly, then he will have difficulty consuming these grain products. Children are high-end consumers of cereal and bread products. They also consume corn sweeteners in beverages. To summarize key facts regarding organophosphate exposure. Organophosphate pesticides are neurotoxic. Chronic low-level exposures may contribute to attention deficit hyperactivity disorder prevalence, and chlorpyrifos is the most extensively studied OP and is found to be a contributing factor in the development of autism, pervasive developmental delay. We know that children have significantly higher OP exposures than adults or teenagers because CDC researchers found children 6 to 11 years of age have significantly higher OP chlorpyrifos exposures than adults or teenagers. How can co-exposure to mercury and fructose make OP exposure more harmful? As was previously mentioned, high fructose corn syrup may contain mercury residue as a result of the use of mercury cell chloralkali chemicals in the manufacturing process. Although this mercury residue in the fructose is likely inorganic, it can still cause a problem because in the gut, intestinal flora may use it to biosynthesize methylmercury, which is very neurotoxic. This chart shows how high fructose corn syrup consumption increased in the U.S. from the early 70s onward. The peak consumption occurs between 2000 and 2002. Can we explain the PON1 gene variation associated with autism in the U.S.? Maybe, maybe not. Do U.S. residents have more mercury exposure than Italians? Well, here on this wonderful picture, we can see the spatial distribution of global anthropogenic emissions of mercury to the atmosphere. So over here in Europe, in Italy, you can see that there's far more mercury exposure from the atmosphere than over here in the U.S. So they seem to get more mercury exposure than we do. But we have the PON1 gene variation in our population. From where else might U.S. residents get more mercury exposure than Italians? Well, U.S. residents consume high fructose corn syrup to the tune of greater than 38 pounds per person per year, while Italians generally do not consume high fructose corn syrup. Why? Because in the European Union, high fructose corn syrup is subject to a production quota because the European Union is a major sugar beet producer. So they only allow 5% of the sugar in their country to be of high fructose corn syrup, which is by definition a sugar substitute. How can consumption of high fructose corn syrup make organophosphate exposure more toxic? Consumption of high fructose corn syrup can lead to calcium loss in humans. And PON1 activity is calcium dependent. So with less calcium availability, there's less PON1 activity. The activity of PON1 is impaired in children with autism, and this leads to greater susceptibility to the neurotoxic effects of organophosphate exposure. So imagine if mother is eating a traditional Western diet in the U.S. And conventionally grown grain, then she's getting quite a bit of organophosphate exposure. High fructose corn syrup consumption is a factor in the development of autism due to the reduction in PON1 activity if mom is also consuming lots of high fructose corn syrup. Is there any correlation between the consumption of high fructose corn syrup and autism? In an earlier study, we compared the rates of diagnosed autism spectrum disorder for California, which is the only state that reports the number of cases of autism dating back to the mid-1980s. The annual net growth in cases of autism ranges from 9% to 11.8% between 1987 and 2006 and 2007. This net growth is consistent with the growth found in other states. Our data here shows that the annual growth rates of autism in California peaked in 2001 and 2002 at 19.6 and 19.4. and then declined to 11.8% in 2006. Our table here also shows the per capita consumption of high fructose corn syrup. Coincidentally, the peak years of consumption of high fructose corn syrup in the U.S. occurred between 2000 and 2002 at 44.6 and 44.8 pounds per year. Back in 2000 and 2002, most of the high fructose corn syrup probably contained mercury. As per capita consumption of high fructose corn syrup goes down, so does the percent growth of autism. In addition to PON1 suppression, how else can consumption of high fructose corn syrup contribute to the development of autism? Consumption of high fructose corn syrup leads to zinc loss and copper gain in humans. Zinc is required to support metallothionein, which is a metal transporter protein. Humans cannot excrete metals without metallothionein. Autistic children are often zinc deficient and have metallothionein dysfunction. And here's a flow chart to show this dynamic. With consumption of high fructose corn syrup, we get zinc loss, and this leads copper gain, and leads to metallothionein dysfunction in children with autism, where the zinc to copper ratio is significantly less than 1, where then there's mercury accumulation and other heavy metal accumulation, and this can lead to impaired learning and reduced plasticity in the brain. With normal functioning metallothionein, when you have mercury exposure from the environment, then your metallothionein gene is expressed and you get the transporter gene working properly in excretion. Okay, here we go. So our take-home facts are that we eat high fructose corn syrup in such a great quantity as to create mineral imbalances that destroy our ability to process and excrete heavy metals and organophosphate pesticides. Our children are increasingly at risk of developing learning disorders, those found in the autism spectrum and ADHD. From 2005 to 2010, the number of American children ages 6 to 21 receiving special education services has increased 91% for autism and 38% for developmental delay. So our most recent publication is here, and it goes into great detail about all the interactions that all the different pathways that high fructose corn syrup consumption creates conditions for autism. And it's available for free, so you just click on that link. And this has been brought to you by myself, Renee Dufault, with the Food Ingredient and Health Research Institute. And I thank you very much for your attention, and I guess we'll have questions.
Thank you so much, Renee, and thank you, Martha. So now we have some time for questions. We've got about 23 minutes, and we've gotten a few questions coming in here. Why don't we start with a couple that might be easy? So the first question is there any evidence that ultrasound plays a role in autism? And that could be for either Martha or Renee, if you know of the research in that area.
There is some evidence suggesting. Go ahead, Renee.
You go ahead, Martha, because I have no idea.
Yeah, well, there is evidence. There are people who are concerned with ultrasound, and what I tend to think, I'm more of a physiology-oriented person than a epidemiology-oriented person. It isn't really an either-or. It's just that's how my mind works. I process that information more readily, and one would wonder what the mechanism would be and what kind of impact would the burst of sound have on a developing fetus and developing fetal brain and immune system. So there have been people thinking about the epigenetic impact of ultrasound being to sensitize, overly sensitize the developing brain and immune system. It's not like one of the problems with a condition like this where the final common pathway is inflammation and oxidative stress and mineral imbalances and copper, zinc, there are a lot of things that can do these things, but significant concerns have been raised for some time about the impact of ultrasound on neurodevelopment, including by one of the world's leading neuroscientists, Pascal Rakish, and now it's emerging further.
Great. So we've got another question related to, is thimerosal still found in children's vaccines? I believe it is not, but I don't know if either of you want to elaborate on that.
The only vaccine that it's found in for children at this time that is the flu vaccine.
Okay, so I have a question for Renee. So the questioner says that an independent audit by Duke University found no mercury in high fructose corn syrup. Do you want to address that particular finding, Renee?
Sure. Those samples were provided by the corn refiners themselves. So first of all, they weren't third-party collected. And it is possible, you know, our assertion was that if you use mercury grade hydrogen chloride and caustic soda to make the high fructose corn syrup, you're going to have mercury residue. So, you know, they can whip up a batch of high fructose corn syrup without using mercury grade chloralkali chemicals, and they would find no mercury residue. That's how you explain that. But Canadian scientists in 2010, which was way after the Duke analysis, they found mercury in their fructose up in Canada. So, you know, if the corn refiners decide to go and change their process so they can collect samples that are mercury-free, that's how that happens, as far as I can tell. It's important to understand that trace amounts of mercury are allowed in food ingredients. There's nothing illegal about it. They're allowed in certain food colors and in the chlorine that is used to bleach flour. There's a certain amount of allowable mercury. So, you know, the corn refiners are doing nothing illegal. One manufacturer told me when I started my investigation that they preferred the mercury grade chloralkali chemicals because it enhanced the corn syrup product shelf life, because mercury prevented you know, the product from going bad. So, you know, that's how I would explain it.
Okay.
Especially since Karen Rideout and her team in Canada found mercury in the samples they collected in 2010.
And here's a related question. Why single out the high fructose corn syrup? And then does the PON1 gene affect other physiological processes, or how does it relate to other outcomes?
Yes. Well, I single out the high fructose corn syrup because that's where the research led us. It's not like we went looking for it. That's what we found. And we looked at what Americans eat in great quantities. And, you know, when you're consuming less than a pound of spinach per year, but you're consuming close to 40 pounds per year of fructose, you know, and fructose has been shown in human beings to lead to essential mineral imbalances, you know, then you want to look at, well, what do those minerals, what are they used for by the body? Then you look at the mechanisms, and that's where the research led us. So it's not like we were looking at fructose. That's just where it took us. And then the other thing is the PON1 gene is key for other things as well in hypertension, cardiovascular disease, all of the modern Western diseases. The PON1 gene has some role to play, and in terms of PON1 activity is very important, and if it's not happening, then you're more at risk of cardiovascular disease, more at risk of diabetes. And so that it's just part of that whole metabolic syndrome thing.
Great, thanks. So here is a question about whether or not there have been studies of farm worker children and incidence of autism, and how can exposure to OPs in a mother impact the fetus? So 2 questions, kind of.
Yeah, there's been quite a few farm worker studies done by Brenda Eskenazi, I think that's how you pronounce it, at UC Berkeley. And she has found that organophosphate exposure does impact of the woman while the child is in the womb, has led to pervasive developmental delay and so forth. And yes, when you consume a diet of fructose and you're pregnant, you are adding a stress to your body. And another researcher found that she wasn't looking at fructose, but she did find that homocysteine levels were elevated in women who had given birth to children with autism. So there needs to be more research, but homocysteine levels are elevated, and that indicates oxidative stress in the mother, and that could easily create conditions for in the child, so that child is functioning in a mode of oxidative stress. But I think Martha could answer that one as well. Martha?
Yeah, so there's two kind of ways of thinking about how the autism gets created. There's a higher risk, but what is it that leads to autism? And one theory would make general statements about how these types of chemicals can impact early processes of brain development, how the cells originate, where they travel to, how they work. And there's another way of thinking about it, which is that you've got your homocysteine, which indicates oxidative stress and more inflammation, and you're having an impact on the set points of reactivity of various cellular processes and signaling systems. And in the latter model, you could impact brain development during fetus, but you can also impact how jumpy and irritable the immune system is into the lifespan and even throughout life. You're basically changing the set points. And so when you do that, you can create the conditions for the kind of brain inflammation that I showed a slide about, or a few slides about, in my talk. And I think this is important because I think that we need to consider that it's not just having things that happen before you're born that create autism, although it's very important, but it's also the things that go on every day which make the cellular chaos worse if it's a lot of pesticides and toxins and lots of high fructose corn syrup and mineral imbalances, or better if you stop eating foods with pesticides, if you eat high nutrient density plant-based organic food if you can afford it, and so forth. So I think it's important to have the broadest possible model to continue to give importance to the real things that we can do to have a real impact on a daily basis, even while we also want to prevent the things that happen to mothers who are pregnant.
So
that's what I have to say, so we can take another question.
Great. So we've gotten a couple of questions on whether other sweeteners, including artificial sweeteners, are of concern in risk of autism, and also a question about wheat products and what role they play. So I don't know if either one of you wanted to answer one or both of those.
Well, can you Renee, talk about the sweeteners?
Yeah, I'll try. I know that some of the sweeteners in the high fructose corn syrup product line, so at a high fructose corn syrup manufacturing plant, there's a product line. So you start with corn and you end up with high fructose corn syrup, but there are products in between. So there are some sweeteners in that, other corn sweeteners, and that are considered sugar substitutes. So I've not done any testing, and I don't know anyone that has. That's something that should be done as to whether or not there be mercury in those sweeteners, or if those sweeteners would lead to the same mineral imbalances that consumption of high fructose corn syrup leads to. those sweeteners have not, there's been no studies to my knowledge on what they might do. I hope that answers the question.
Yeah, so basically there isn't the same kind of study of the other sweeteners.
Right.
I would be concerned about sweeteners for other reasons too, which is that if you have metabolic imbalances, you're driving your blood sugar in an unhealthy direction. And along with autism, we have increases in type 1 diabetes and other metabolic concerns, obesity. So the sweeteners can act by other mechanisms as well. That would be made worse if the presence of mercury is also going on. And about wheat, in addition to the organophosphates, we have issues of wheat creating challenges in the intestines, creating gaps between intestinal cells associated with a chemical zonulin, which pries open spaces between cells. And those spaces in normal people close quickly. This is work of Alessio Fasano at the University of Maryland. But in people with autism and with various autoimmune diseases and other psychiatric conditions, it takes a while for these gaps to close. And during the period of time when they're open, you have intestinal permeability and the exposure of the blood, of the immune cells in the blood to substances that ought to be further broken down before they're absorbed, but sneak in through these gaps and these opportunities. And so it seems to be that, and there are arguments about the hybridization of wheat creating a much greater concentration of the substances that do this. So I think, again, we have multiple things going on at the same time that are making it, each making the other worse when you eat a lot of sweetened, refined wheat products.
And one thing to bring out is the fact that children are recovering from autism, symptoms of autism, with a change in diet by eliminating fructose and conventional grains. I mean, I personally know of a child that completely recovered, and he can have grain as long as it's organic. And of course, he's eating a whole food diet with lots of spinach and really nutrient-rich foods. So, yeah, the fact that they get better with a change in diet lends credence to what we're saying here.
Yeah, and that these things are not just, an influence on pregnancy or early epigenetics, but you can start turning around these processes. Like if you have depleted metallothionein and low zinc, and you work on improving the supplies that are needed for the body to recover those systems, the nerve cells are going to perk up and work better, and the glial cells. So it really is a two-way street, and I emphasize that very strongly in my book, The Autism Revolution. And I also gave stories of people who got better doing these things.
Yeah, and that was actually one of the questions, can autism be overcome? And I just wanted to add a follow-up question to that, and that is there a role for clinicians for dietary interventions or for educating clinicians, both primary care and pediatrics?
I think there's an enormous role. Personally, I think that we already know enough that if primary care pediatricians and nutritionists could get on board, even with elementary dietary optimization, avoiding junk food, avoiding high fructose corn syrup, and going after what you could call nutrient flooding, lots of fruits and vegetables, and minimizing allergens, and being rigorous about keeping people healthy and making sure they sleep well and don't have, irritation and colic and so forth. I think that we could do a lot to reduce the risk of autism, to reduce the severity, and maybe even to head off a fair number of cases, just because the irritation of the system by this onslaught of nutrient-depleted food and of toxic substances that wear down our cellular resiliency. I think that those things are contributing greatly to vulnerability to autism, and we can turn it around, and we can catch it early enough that the baby doesn't cascade into autism. in the first part of my book, I talk about snowballing into autism, cascading into autism through a whole series of often seemingly mundane little crises that just make things worse and worse until things tip you over into an autistic regression. But I do think that can be reversed, and you know, in writing that I'm going to be doing going forward to publicize what I've tried to say about my book, I think the two biggest things are that there's things that we can do in our diet individually and as a country that could make a huge difference, and that it's probably not going to be just one thing, but the cumulative impact on our bodies of the total load of all of our exposures, and we can chip away at that in many directions and make things better by reducing total load and optimizing excellent nutrition.
Yeah, I think that's a very important take-home message, and as we're addressing also the obesity epidemic, it will definitely help with that as well. So going back to a more technical question, have there been studies of mercury levels in populations with the PON1 gene of people with and without autism, comparing those mercury levels? I guess probably that's for Renee.
There has been it was done with the Inuit or Nunavik, the indigenous population. They looked at mercury and PON1 levels, and they found that PON1 levels did in fact decline with mercury exposure. They were looking at dietary mercury exposure. That has been done, okay. But they didn't look at autism. That was that they weren't looking at neurodevelopment.
Which kind of points to, I was wondering if you, either of you had viewpoints on the current state of the science with respect to environmental exposures and autism. I know there's been some studies of pesticides and mercury and so forth, but
I have some views I'd love to share.
Yeah.
I just went to an epigenetics conference, and I was taken aback by how limited the current research paradigm is in their thinking, because you know, they're only looking at one or two variables, and they're not looking at diet at all, frankly.
In epigenetics researchers?
Well, in the epigenetics conference I just attended, diet was not a factor people were looking at. It seems like the environmental toxicology group, which is, you know, they're sort of heading off towards epigenetics. They're looking at the traditional environmental toxins like pesticides and lead and mercury and PCBs and so forth, and they think outside of the body, you know. So, but they're not looking at how what we eat determines how we're able to process those things, or how what we eat.
That's so ironic.
Yeah, it's crazy. So what I see in research that they're not doing is they're not looking at taking into consideration what we eat as to how that impacts how our bodies behave, how our genes function. So there's a missing link there.
And then yeah, right. And go ahead. That's really right. That's so disturbing. I was somewhere else and couldn't go to that conference. I'm sorry to hear that.
Yeah, well, that's what I saw. So I saw we have a long ways to go, because they have quite some time to go to look at the bigger picture. That's why we say macro epigenetics. You know, there's so many things you have to look at. I'm not even sure we have the capability to look at all the factors that are going on, frankly.
Well, you know, we're not going to be able to sort it out, because they're at the one-by-one factor level past a certain point. There are people who are pushing. There's plenty of data on diet and epigenetics, and it really needs to interact with toxics and epigenetics. I just want to put a positive word in here, which is that the ratio of funding for environment versus for genetics compared to environment and autism is somewhere between 10 and 20 to 1. And even with that, some of the odds ratios, some of the impacts of environmental substances that have been discovered on these miserable small research budgets that people have been quite impressive and greater than the impact of the vast bulk of genes that have been identified. that said, I do think that we need to just jump up a couple of quantum levels of energy to really turbocharge our efforts, if you don't mind my mixing metaphors, to get moving on this. And particularly because with the diet thing, that there's a lot of personal choices that we can make, and there's a lot of reasons to improve food at the individual level, at the cultivation level, at the production and distribution level. It's a huge issue, and so I think that we need to, really pull together those of us who think food is a gigantic issue in autism and support each other and figure out ways to get the word out that are more effective and more leveraged going forward.
Right. And another thing is research often, there's money to be made on patent and treatment of disease. So a lot of folks are focused on finding treatments and as opposed to prevention. So preventive medicine has historically been underfunded, and I think that autism, from our perspective, is we're doing a preventive medicine in approach, as well as treatment. But if you get rid of the disease, then there's no money to be made, frankly.
Well, this is why, I want to emphasize that prevention is not just prevention of people being born with autism. It's prevention and reversal during the lifetime of a lot of the complications and difficulties. And so we need to keep on doing that. And there's a lot of people who can get behind that, who don't have a dog in the fight regarding making money. And in a way, I really think it needs to be some kind of a social movement to make up for the competition we have from the people who are going after the patent. And also be effective.
And we are out of time, and I think that's a good place to end. We definitely want to improve the lives of people with autism by improved diet, improved environment, and we certainly want to prevent autism whenever we can. And I want to thank our presenters, Martha Herbert and Renee Dufault, and also direct you to the Healthy Food Action homepage, where you can learn more about our current actions and also view recordings of past webinars. A recording of today's webinar will be available next week at healthyfoodaction.org. You can also follow Healthy Food Action on Facebook and Twitter. If you want to learn more about chemicals policy, you can also visit Healthy Legacy at healthylegacy.org. Thank you to all of you for joining us today.
Thank you.